Overview of intervention programs for young autistic children. What are they? What do they target? And where can I access them? My name is Matthew Lay. As always, I will be your host, and I'm very excited to not be at home in my little condo talking to you on webcam, but being here back in the studio. Signs truly that things are changing in the world. And for our inaugural studio webinar, I'm very pleased to have you've been here before, so Tracie Lindblad. Tracie, thank you for being here.
No, you're welcome. It's great, like you said, to be out of the house and actually at work.
yeah, exactly. Out and doing what it is that we do. So I'm not sure how you got here today. Maybe someone sent you the link. We always say share it with your family and loved ones. If you found it informative, maybe you got an email. Who knows, but we're glad you're here. For those of you who are new to Autism Ontario, our mission is creating a supportive and inclusive Ontario for autism. And our vision is best life, better world, and making autism matter. And on the desk here, what it is that we do is we try to educate and inform. And in saying that, one of the big things that I'm going to do is I'm going to try and get you answers to your questions from Tracie. So submit them at any time in the Ask a Question box. They'll come to my iPad, and I will aspire to get you the answers. If you have any technical issues, click on the help button. And there is a series of resources. It's jam-packed, just like our agenda today, full of helpful information. So make sure that you check that out and download. The deck has links in it. There's also a couple of packages there for you. And then finally, I know you're all going to stay to the end because it's going to be great, but if you have to leave before the end, there is a survey option. It'll pop up for those who stay to the end. Please complete it. And if you leave early, click on it on the toolbar on the left and fill out the survey before you leave. These surveys help us provide better content and better serve you. All right. Got a lot of that out of the way. Tracie, I know you, a lot of these people do, but maybe talk about what brings you here to the desk. What's your experience in all of this?
Sure. I'm a speech and language pathologist by trade. That was my first degree. Mm-hmm. Then I was working in the school boards at the time, so I decided to get a Master's of Education in Curriculum. Yep. So added that to my toolkit. And then last, I am a board certified behavior analyst as well. Lots of experience in the past in the public sector and school boards, as well as private practice. But currently, I'm the subject matter expert speech language pathologist for Autism Ontario. Okay,
that is a mouthful. But clearly, when we start getting into the content, you will understand why Tracie is here. Now, I have no conflicts of interest. I am just a moderator. Talk to us about if you have any conflicts as well as the language we'll be using today.
Sure, happy to. So the conflict I have to declare is that I'm salaried by Autism Ontario, so I get paid a salary to do this, but I have no other conflicts. The information I'll be presenting, the things that I may be recommending, the programs I'm talking about, no conflicts to declare with any of that.
Okay.
Also for language, I will be going back and forth in the type of language I'm using during the presentation. So people talk about autism now differently, depending on your perspective. So you may be a researcher or a clinician, and we may use a different term. Family members or autistic individuals themselves may prefer something else. So we want to be respectful of that. And so I'll be going back and forth between person first identity language, which would be a child with autism, right, or identity first, autistic child. And so I'll be interchanging those throughout the presentation.
Great. Much of what we're going to talk about today is facts. We are we're going to be talking about a number of things, but any opinions that come across are Tracie's opinions or my opinions. They don't necessarily reflect the position of any government organization or the like. Our goal here is to give you the information to help you make informed decisions. Also, we won't be able to answer specific questions about your loved one's treatment decisions, or anything that you've come across. What we will try and do is take your questions and try and provide you the best direction possible. And once again, a lot of that direction will be found in the resources section, which is located on the webinar interface. Now, What do you hope our audience takes away from today's webinar? What should they learn?
So there's 3 main learning objectives from today, because it's going to be a lot of information, but I really hope that people will be able to recognize several commercially available treatments or programs. So start to learn the names of those, recognize that you've heard about them, identify specific skills or goals for your child.
Right.
So where are their needs? Do they have fewer needs or greater needs than perhaps someone else that you know? And then where can I obtain those programs and services? So I really want to help people find where to go get more information or where to access services. May talk a little bit about funding, but it's really about learning about those programs.
Excellent. And those are, no matter what topic we talk about here, those are the #1 things that people are looking for. To get us through that, we're going to talk about important skills for children at early developmental stage. We're going to talk about empirical support and evidence-based practice. This is going to be very important. The type of treatment programs that are available, and finally, and probably most importantly, helping you make decisions about the programs that you're going to be looking into. So many of you are likely have a newly diagnosed child or are here for the first time. When looking at a newly diagnosed child or children of any diagnoses, what skills are important? What are we tracking as far as development goes?
Right, so the one thing to look at is what are those prerequisite skills or foundation skills,
right,
where all your other skills are built upon. And so those skills are really important to focus on, and those are the skills that are on this slide, a number of different areas. And why they're important is because those skills are required before your child can learn more advanced and complex skills so that they have an optimal outcome.
Mm-hmm. Okay, so I said something off the top. I used some words: empirical, evidence-based. They sound pretty clinical. What does it mean? Why is it important?
So it's important to understand the difference, because I'll be using these terms throughout the presentation. Empirical support means research studies, so the empirical or research literature. And when we're looking at research studies and how we rate or how we look at different programs or services is by the quality of the study. We also want to see where has that study been researched. So is it just in one lab or is it across the world? And last, it's really important that you match what you're reading to your specific child. All individuals are different, and especially individuals who are neurodivergent. You really want to match your needs of your child to the treatment. And when we look at that, there's a second piece to that, which is evidence-based practice. When you're interacting with professionals who are either board-certified behavior analysts or from the field of ABA or are occupational therapists or speech-language pathologists, all of those regulated health professionals need to operate in a similar fashion,
okay,
in that they have to go through this evidence-based practice process. So it's actually a process, it's not a thing. And that means that you use your external empirical support to guide your treatment decisions. You use your clinical expertise and knowledge from your field. You bring that family into that discussion. So the family is part of that decision about what should we do and why. And then you take data while you're going through treatment to make sure that it's working for that specific individual. And that's how you figure out if something actually has evidence that it's effective.
Right.
So that's important when we look at each of the programs we're going to be talking about.
So there's studies, there's been, we know that there's studies that happen all the time. There's clinical practice of which you've been a part of. Is that where a lot of this comes from? Your own research and your own practice, or where are we getting all this data from?
So no, it's not my own research or clinical practice. I'm not going to be presenting on my clinical expertise or opinion. It's really, we're going to be presenting facts. So it's the factual information taken from research studies. All the evidence that exists today, so current research studies, with a caveat that there's hundreds of studies now that are coming out weekly,
right,
so pretty hard to stay on top of it. But I think the important thing for parents is that what you hear today may differ from your own experience, may differ from what your friends or social media is saying,
yeah,
and as a consumer, you want to be informed. you have the right to all the information in order to make the best decision for your family and your child.
I mean, you know, when we look at it like a purchasing decision, which is, you know, the terminology that you're using, I mean, you know, this is probably, these decisions are some of the most important you will make for your child in general. A reminder to our audience, you can submit your questions at any time. There is a Q&A icon on the left toolbar. If you don't see the question box open, type them in. They will come up to the iPad here, and it will aspire to get answers. Okay, let's move into the treatments, commercially available programs, and get into all of this. You mentioned something a little bit before about parental involvement and the importance of that. Talk to me a little bit about what is available for parents.
Right, and the area of parent involvement, or what we call parent-mediated interventions or caregiver-mediated interventions, is that there's a significant amount of literature to support the outcomes for that type of program. And sometimes you'll hear it called, now there's a new term, manualized interventions. And what we see is that parents are need to learn some of these tools and techniques in order to facilitate their child's learning.
Right.
Parents spend most of the time with their children, and especially when they're very little, those really young infants and toddlers, it's really hard for therapists to work with them. And much of the time, the parent actually has more experience with their own child or needs to learn those techniques so that they can be carried out when they're not in therapy.
I can only imagine. We saw this during COVID where so many parents had to become teachers and didn't have the skill set to do so. There is training for parents?
There's training for parents. So these programs are actually involve the parents being trained as the therapist.
Okay.
So there's training for parents, and it can be done in the home, it can be done in a clinic. Lots of times now, one of the benefits of the pandemic is that we see that there's really good evidence that even virtual training has been very effective.
Yeah.
Easier for people in rural and remote to access as well. So it's opened up access to some of the programs. The other thing about access is some of this is funded under government, so it could be part of the Ontario Autism Program.
Right.
If you've been invited to get that level of caregiver-mediated early intervention, it's called, under that program. But these parent training programs are also provided by clinicians, so by behavior analysts, speech pathologists, occupational therapists, as part of their typical practice.
Okay. So if you're not able to go that way, there are other places where to find it. Okay, intervention pathways.
Intervention pathways.
What is this? This looks like a flow chart to me. What are we looking at?
Right. So one of the things about what we know and what has come out of the research is that what makes these programs effective is following this type of behavior skills training approach. And it's not just for parent-mediated, it's for many of the other types of interventions, and it's used in other fields as well. So when you're doing training somebody, you really want to use this approach where it's this step-by-step model, where first you explain the skill, so you get some education. The skill is demonstrated, so you know what it's supposed to look like. You practice and role play it, and you get feedback on your ability to perform that skill. And then you're expected to generalize the skill, so homework or home practice.
Right.
And so you're learning a new skill, you're being coached through it, and you're implementing it, and you're feeling better about it because now you've got a new skill set, and you can see the outcomes in the child. So most of the programs that have been found to be effective for parent-mediated intervention have a component of this behavior skills training embedded in them.
And what kind of, what do they target? What are some of the targets for these programs?
Right. So the parent-mediated programs target a number of areas, and so a subset. Remember that that other slide that had lots of skills on it? This is a subset. So these are the very beginning skills that we look at treating or providing intervention on. Some of the caregiver-mediated programs, and you'll see as we go through a number of them, some of them will focus on one or two of these skills. Others will focus on, a few more, and there are a couple programs that will focus on all of the skills. So you have to keep in mind, again, this is where that matching comes in. what does my child need and which program matches my need or their need the best. So we're looking at things like joint attention, language skills, play, responding to others. We're looking at cooperation and behavior, their imitation skills, visual skills, like do they understand pictures, motor skills, and then eating. So those are the early skills.
Right. Okay, so this is the first of a few slides that we're going to be going through, and we're going to be reviewing a number of programs. For those of you out there, we're not going to go deep into all of them. We simply do not have the time. But you can get this information downloaded from the resources section. It's going to be in the PowerPoint, of course, and there's links directly to these programs. So the first one that we're going to talk about is ESI certs. That definitely needs a rebrand or some sort of name. What is this? What type of service is this? And what's it targeting, or what is it good for?
Right. And just to further clarify what Matt was saying or add on to what he was saying, I'm going to provide, in each of these slides, they look similar. So under providers, it's the typical professional that usually performs or provides that program or commercially available marketed program. The type of service it is, so the next section is all the caregiver-mediated programs. A general description, the ages, if it's available, that it's targeted for. The targeted outcome, so what they propose that the program does actually affect a change in. And then the rating is what kind of evidence to date have we seen about these programs, and then funding. Where can you get these programs? So for certs, we find that speech pathologists or CDAs, speech assistants, generally are trained in this program. It comes out of the field of speech pathology.
Okay.
And it really is for all ages, so there isn't an age range for certs necessarily, but they really look at social communication, emotional skills, building that social bond with the child. And what we have found with certs is that most of the outcomes have been in that language area. So may lead to an increase in receptive language and understanding, but really social and that social connectedness. There's some emerging evidence. So there's not, we've got some evidence, but we need some more before it's classed as a firm evidence-based practice. Can be eligible under the OAP, but again, many speech pathologists are trained in certs and will provide that type of treatment.
All levels from nonverbal through, you're
all
seeing?
Levels.
Okay,
all
great.
levels.
The Hanen, more than words.
So Hanen is a program, again, mostly implemented by speech pathologists or speech assistants. It's a structured parent coaching. Typically it's a structured program, and there's a number of consultation visits. They videotape, review the video, not a specific age. Social communication and play skills are the main outcomes or the main targeted areas in Hanen. And right now, there's insufficient evidence to support this program, although it is widely adopted, and many parents feel that it's very worthwhile. So it's one that parents ask for a lot. It is not eligible currently under the OAP.
Okay.
But again, like I said, many speech pathologists all over Ontario are trained in Hanen, and families have felt that it's been helpful for them.
What is the difference between a caregiver-mediated program and a structured parent coaching program? The difference between the two that we just saw.
So they can be very similar.
Okay.
They can be the same. So parent-mediated means the parent becomes the therapist. The parent is the mediator in the treatment. And this is a structured one in that it defines the number of sessions, how the sessions are going to look, but the parent is delivering the treatment.
Okay. Once again, in the resources, when you download them at the very end, there's a series of links, and there is direct links to each of these items, so you can dive in a little bit deeper. The next one is Jasper. That's a good acronym. That one works.
You like that one.
I like that one.
I'll tell Dr. Kazimi that.
Okay, fair enough.
So Jasper, which is joint attention, symbolic play, and emotional regulation, is another caregiver-mediated program. And this one is actually also classed as a naturalistic developmental behavioral intervention. Mm-hmm. So there's some new acronyms that are out there that just further explain the program. Really targets 1-year-olds to 8-year-old.
Okay.
So there is an age band, and the outcomes are about increasing the type of play, spontaneous play, duration that children are involved in an activity, and initiation of communication. And so it's really got a more narrow focus. If you think about those prerequisite skills we talked about, it's got a bit of more narrow focus. Good evidence showing that's effective for children. It's on the national standards list as an evidence-based practice.
Right.
So to further about the national standards list, the national standards list is a report, and it's in the resource section, and there's a link, that looks across all therapy types, all clinicians, all providers, fields, and what it does is looks at the evidence and it rates it for you. So for clinicians or for parents, it will tell you whether it's got sufficient high quality clinical outcomes in order to label it as an evidence-based practice.
Right.
So Jasper actually is on the list.
Excellent. So that's in the resources, it's under additional resources, so it's its own, and it has that link. I assume that when we look at these very evidence-based programs with very specific age brackets, 1 year to 8 years versus 2 years to 16 years, is that because in the research they see the efficacy going down the older the child gets? Is it that tight when they're looking through it?
So typically the age range comes from the participants who are in the studies.
Okay.
So that's why I'm saying you need to match the studies with your child.
No, yeah.
So sometimes what they'll do is they have age cutoff, because especially when we were talking about Jasper, they're looking at very, very early skills.
Right.
So sometimes in some places, so not in the research studies, but in other places, other providers may take a child who's over the age of 8, but is developmentally or in displaying the same skills as someone who's younger than 8.
Right.
And so that program may still be applicable for them, even though they're outside the age range that were included in the study.
Right. We have a question from our audience. They want to know what are some examples of receptive language.
Thank you for that. Good. And please, stop. I'm there's so many labels, it's hard, but reminding me to speak in English is very important. So receptive language is your understanding of spoken language. It's your comprehension.
Okay.
Generally, it's about spoken language, but comprehension also comes into when you're reading.
Right.
So understanding what you're reading, but it means your understanding.
Perfect. So we're going to clarify again, this is coming from our audience, but similar to my question, because I think now people are looking at what they should be looking at. What does insufficient evidence mean? Does it mean that it's ineffective? Does it mean that we just haven't gotten there yet? I mean, you've chosen some to be on here that have insufficient evidence. Why is that? So,
couple reasons. One, providers are trained in those techniques, programs, and again, it's awful to say, I feel really strange saying it, but autism has become a business, just like any other industry, and there are people who market programs, right? So there's conferences, there's training, they get paid for that, and so really what you need to do is become aware of what you need to look for. And so insufficient usually means there may be small numbers of studies, or very narrow studies, like low number of individual participants, or the person who developed the program was headed the study.
Okay.
So it's not been replicated somewhere else.
Right.
Or maybe just in 1 or 2 places. So we really need to get a lot more assurance that we'll see the same outcomes if it's been replicated, if it's done somewhere else, if someone other than the author is involved in the study. So that's what insufficient means. If there were studies that showed ineffectiveness, that it actually didn't give you outcomes, or there was some harm in it, then I would be calling that negative evidence.
Okay.
So it just means that we need more studies. We're still working.
We've got a bunch to get through, so I'm going to get back to the content. Lots of questions coming in. If we don't get to them all live, we assure we will get back to you in writing, or we'll just invite you back. We're having such a good time. Pivotal response treatment is the next one, known as PRT.
Yeah, PRT, another caregiver-mediated program. It's a naturalistic behavioral intervention, again, and it uses a child's motivation to teach, communication. Wide age range on this one.
Yep.
Again, joint attention, the eye contact, requesting skills, so learning to ask and get your wants and needs met. which is an early skill, social engagement, communication, turn-taking skills, play skills. So you'll start to see a theme. That's why these are all grouped. They all work around the same things. Again, good evidence showing effectiveness on the National Standards Report, and it's eligible under the OAP as one of the eligible programs if you're getting funding. But again, lots of individuals trained in PRT and provide that intervention as part of their practice.
Excellent. Next one on our list is Project Impact. If you know the person who did this one, I would say this is even better branding. But what are we talking about here?
So Project Impact is a caregiver-mediated intervention.
Yep.
And again, it's a naturalistic developmental behavioral intervention, and it combines small group sessions with consultation directly with the parent and the child and coaching, that direct coaching. It can be more tailored to your specific needs. Very helpful if it's a new diagnosis for you.
Okay.
Very helpful. The curriculum is well developed. Infant to 6 years of age. Again, so when they developed it, they were really targeting those parents with a new diagnosis.
Right.
Social communication, imitation, and play skills are what you're going to really target in it. Good evidence for effectiveness on the National Standards Report and eligible under OAP.
Excellent. And social ABCs.
Right. So social ABCs is a more local program. Developed locally for sure. Dr. Jessica Bryan, I think, is one of the authors of Social ABCs. Early educators, psychologists, speech pathologists, behavior analysts have all been trained to provide this intervention. Caregiver-mediated, so parents are being trained. Again, naturalistic developmental behavioral intervention. And 12 months to 3 years is the age range that this one targets. And again, that's the research, the group. Child communication, heavily targeted. That kind of sharing and social reciprocity are going back and forth. Positive emotions with the primary caregiver. So really trying to forge that bond between the parents and the child and make that more pleasurable. Emerging evidence of effectiveness. And actually there was a brand new study I read last night on it. So that's how much things are coming out at the last minute, trying to keep on top of it. So some really nice evidence from that study that was done locally in Toronto or Hamilton. And still probably going to need a couple more studies done by different teams, but looking good. And it is eligible under the OAP. And again, a lot of people have been trained now in social ABCs. So
clearly without all of the evidence in, the program can still be eligible under OAP, which is important to note, and I think helps answer that last question. The Play Project. So the Play Project, again, is caregiver-mediated. Large number of individuals have been trained in it. It's a naturalistic behavior intervention to teach play. So the age isn't stipulated in this one. Right. But it really is about parent-child interactions through play. Okay. So really looking at a more narrow focus than some of the other programs. There's emerging evidence of effectiveness, and it is eligible under the OAP. Okay. Is this for, to help just with play, or is it using play to assist with some of the other core skills we were talking about? So both. Okay. So what we do know about play is that through play, you learn language, you learn social interaction, you need to learn how to imitate others because that provides your social skills and learning how to function better in an environment. And as well, early parent-child interactions are usually through play. And so you're really looking at making things more positive, increasing their, on-task attention and focus. So even though it says, we're really looking at parent-child interactions and it's done through play, there are other collateral effects from it. So we got a question from the audience. I wasn't going to break yet, but I had the same question, and I thought maybe I was doing too much and I missed it. What does naturalistic behavior intervention actually mean? So it means that there's a new class of interventions where it's more child-led, so more naturalistic, and it combines both what we know from child development, so those developmental progression, with behavioral principles. Okay. So the ABA, the principles from the field of ABA, so looking at things like using reinforcement, really looking at how do I prompt or help my child be successful in this. So it's a new grouping of programs and development of programs that really look at
let's go back to being more child-led, child-focused. And it doesn't mean following the child around. It means looking at what motivates them. What do they like to interact with? And then meeting your goals within that type of program. So we used to, probably would have just been previously called parent-mediated intervention or parent training.
Okay.
But now if it has to have those components of being more naturalistic, child-led, child-motivated, combining developmental and behavioral principles in it. So there is structure to it, there is data. So it has to have a number of features to be called that, but yeah, that's
most
a new
of the
term.
programs we saw were naturalistic. There were some that were not.
Right.
And so the ones that are not are more curriculum-based?
More curriculum-based.
Okay.
They still should be child-led.
Right.
You still, as a therapist or clinician or interventionist, really want to make sure that the motivation is there with the child is having a good time, they're engaging with you in a positive manner. Like, those are all hallmarks of just a good therapy program.
Right. Okay, so let's get to that. Direct therapy services. Who are the types of folks that we'll be delivering?
So in direct therapy, as opposed to parent-mediated,
Yeah.
this is the therapist that's actually delivering the treatment. So we're looking at the fields of applied behavior analysis, so behavior analysts,
Right.
speech-language pathologists, and occupational therapists. So those are the three big ones I'm going to talk about today. And those are the ones that are now under the core services under the government Ontario Autism Program.
Okay.
But those are your therapists or your clinicians that you first interact with as a parent if your child is showing some struggles or some difficulties or challenges with an area of development.
Right.
You will often go to the speech pathologist or occupational therapist for help, or to the behavior analyst if there's a behavioral challenge. So these are the people that, in many times, these are the first people that parents of children with autism see.
Okay.
And so I wanted to talk a bit about what are those services and interventions those therapists can do on their own. So
Right.
not part of a big program or a parent-mediated intervention.
Okay. So this type of stuff that you should be able to get from that early intervention with a direct therapist, what should you be able to get out of them?
So you really want to look at, again, what are the needs of your child? Because you can get full curriculums. So speech pathologist work, Early Start Denver model is going to be one of those,
Yep.
where it's a therapy, it's a full curriculum. Maybe you just need one or two modalities or areas or skills that you want to learn. There has to be an assessment before a therapist determines goals. You may want just one-to-one treatment. You may want small group. You might want just consultation and collaboration with a team that you have. So all of those providers from those different areas can do all of those things.
Okay. And so we just went through a whole bunch of programs that people are excited about and they're looking into. I would imagine assessment should be done first before that. And often, if people are wondering which programs would be best for them, is this someone they could work with to ascertain?
Yeah, absolutely.
Perfect.
Yeah, these are all regulated healthcare providers.
Yeah.
And so their job is to assess, what areas or challenges that the individual child is having, then what makes sense for the parent, what makes sense for the child in their developmental trajectory. So, are there behaviors that are interfering with doing kind of standard therapy? Sometimes there are. Sometimes there isn't a good attention span yet.
Right.
Or there's, challenging behaviors that the speech pathologist would have difficulty, doing a therapy session. So it really, then they can help you decide, what do I do? Who do I see first? Where do I go?
Right.
It's a difficult pathway for parents.
Okay.
And
what are some of the things that direct therapy services will work on?
So the direct therapy services can work on those early skills. So today we're talking about those young children and looking at those early skills. So they can work on those early skills. So in the preschool ages, so those things like, again, just like we saw in the parent-mediated, those initial skills of attention, requesting, increasing their understanding of language, using language, play skills, motor skills, all of those skills, those clinicians can work on.
Okay. And there's different types of services or interventions?
Yep, different types of services and interventions. Again, depends on what you're needing for your child and what training that particular clinician has.
Right.
So that's the other piece of it. All speech pathology is very broad, behavior analysis is very broad, occupational therapy is broad. So you want to actually find people that have experience with autism and experience with the type of treatment that you think your child needs.
Going back to something you had mentioned earlier about autism being a business, right? Is that they're trained, but do they have experience in it, right? Or do they list it, but have they actually done it? Before we move on to early years treatment, I have a quick question for you. I was suggested to use CDAs to provide speech therapy for my son. I want to know what are the differences between SLPs and CDAs, and if you could define both for the audience, that'd be great.
Absolutely. So speech language pathologist is the master's level clinician. So they've had university training in speech and language therapy and assessment, child development, neuroanatomy, anatomy, physiology. So they're the person that actually assesses your child, so they should be assessing your child. Speech assistants and CDAs are communicative disorders assistants. That term is only in Ontario.
Okay.
So that's particular to Ontario. Elsewhere, they're called speech and language assistants. I need one today. But yeah, so the speech pathologist should be doing the assessment, determining the goals, again, like along with the family and everything, looking at the empirical literature. And then they can delegate the actual therapy to a CDA or a speech assistant with supervision. So you are not allowed to delegate your complete profession. There's only parts of it you can delegate. So it does require supervision because that speech pathologist is the one who is trained to look at errors, to individualize if something's not working, to determine if it's working or not. So you really want the speech pathologist involved as much as possible, obviously, but generally we see 10% of direct hours.
So, I mean, in the question, I mean, you can't see a CDA. You
Not
go to
alone.
see an SLP or a speech pathologist, and then the CDA will be the one who's working with.
Yes.
Right? So
Yes.
they're always going to be working with one. Okay, I think I understand, but now we're going to move on to early years treatment. So typically when we're talking about this, what's happened, where is the child, where is the family when we start talking about early years treatment?
So when we talk about early years treatment or preschool treatment targets, what I've done is just taken the parent-mediated group and carved them off.
Okay.
So now we're talking about typical therapy services for children who are in that preschool age.
Right.
Up to grade 1.
Okay.
And those are all the skills, again, very similar to the parent-mediated, because these are the skills you need to be really successful in school and in life.
Right.
And so all of the early years treatment that the different providers provide should be targeting these areas.
Okay. So the first one we're going to talk about, which we've talked about at length here on the desk, is ABA.
Yeah.
Can you help define it? Who are the people that deliver, that sort of thing?
Yeah, so ABA is Applied Behavior Analysis, and Board Certified Behavior Analysts, which is a trademark term, or Board Assistants, or Registered Behavior Technicians are the people who deliver this service.
Okay.
And the Board Certified Behavior Analyst is that master's level person.
Okay.
The BCBA is usually an undergrad with
Yep.
additional training and taking a test, an exam, and then supervised. And the RBT is also called an ABA therapist, a behavior interventionist. There's a number of names, but they're the ones who do the front line.
So it's similar to the CDA and the speech pathologist, that there's the similar setup? Okay.
Similar setup. In ABA, it's a bit more prescribed about what you're required in terms of supervision.
Okay.
How often you directly have to see the child in therapy.
Right.
And that who can write the programs. It isn't advised, it's not quality to have just an ABA therapist, like that front level, and not have someone above them that's devising the program, assessing, problem solving, and things like that, just like speech pathology. There are overlapping areas. So this is where it's difficult for clinicians, but difficult for parents.
Yeah.
So the training of a behavior analyst is very broad, and it encompasses some of the same areas of occupational therapy and speech pathology.
Right.
So it doesn't mean that they're practicing outside their scope, as some people say. It means that they are trained in this, and it overlaps with the other fields.
Okay.
And so the areas of augmentative alternative communication, feeding interventions, motor skill development, language development, social skills, those are all shared between fields.
Right.
And so really it's about, you know, who do you have access to, who fits best with your family, but definitely, you know, you want to check that they have the experience and the the training in the area that your child needs. If any of the professions, so whether you're a speech pathologist, an occupational therapist, or a behavior analyst, if you come to something that you don't have the training or expertise in, you are required by your ethics to refer out to that person. So it's really great if you can collaborate as teams. That is the best.
Always the best way. So there's different levels of ABA or different intensities maybe. Can you talk a little bit about that?
So the intensities are grouped typically by number of hours.
Right.
And by number of goals.
Okay.
So skill areas that you're working on. So focused ABA is if you're doing about 15 to 25 hours or less, generally only 1 to 2 goals, because the whole purpose of ABA is to have intensity. And we know from research that we can change individuals' behavior. So whether it's communication as a behavior or play as a behavior or imitation skills, we need to do that intensively.
Right.
And it's, again, linked to neurology. We're forging new pathways, right? So it takes some doing. So focused is you've only got 1 or 2 goals and you're going to work on those. Comprehensive is when you have a full curriculum.
Okay.
So you have all of those areas, so all those orange boxes. You're going to do 25 hours or more. And you usually have a full curriculum.
Okay.
So lots of targets.
So this is also known as intensive, or I've heard people call it
IBI, Intensive Behavior Intervention.
Yeah.
Most of the literature in the field is called EIBI.
EIBI.
Yeah, Early Intensive Behavioral Intervention, because it comes from a lot of the literature comes from the U.S. where mediation or intervention starts very early,
right.
So young children.
Yeah.
In Ontario, often our children are a bit older when they start intensive services, so we call it IBI here. Yeah.
Before you go, the decision of focusing on 2 or up to 15, so the different, or I think it's up to 15, but either way, the focus on the 2, is that something that is prescribed before going into this, or where does the decision come in about how many things to work on early on? Because I would imagine, as a parent, early diagnosis, there's a lot to work on at this stage.
So it becomes a combination of all of that. So, and that's an excellent question, actually. So any clinician that's assessing a child is required to provide their expert clinical opinion about how much therapy is required.
Right.
So if a behavior analyst is assessing a child, they would do a baseline assessment of all skills, and then they would see how large a gap there is or how far behind your child is, and then they would make a recommendation for intensity, because there is evidence, there's research and literature in our field that tells us that. And we know if you're working on 15 programs, you're going to have many hours a week to meet, at least 15 hours a week to meet 15 programs and get some intensity. So what happens, though, is the professional makes a recommendation, but then it becomes a conversation with the family as a partner in what works for them. And we know realistically there are financial barriers. There may be resource barriers that the parents aren't available, the child's not available. There may be a barrier with the provider. Right now there's staffing shortages, and that's just a reality. And so then there's a discussion about, will 9 hours be beneficial? And so you may end up having a subset of goals that you're working on, or the program looks a bit different. But again, that's individual for everybody. But the parent should have a clear indication from the professional of the intensity required.
Okay, so intensive ABA. Let's talk about some of these terms. Again, we're not going to go that deep, guys. We're nearing, we got some time constraints on us, but all this information is available to you in the resources section.
So I just listed on this slide the typical curriculums right now that are being used in ABA, in comprehensive ABA. the curriculums themselves don't often have evidence because it's how you implement them.
That's where the evidence comes
That's
in.
where the evidence comes in.
Okay.
So when we look at comprehensive ABA, what do we know about it though from the research? We know that, we've gone already what it looks like, but it can be helpful for any age. There's a significant increase in skill acquisition, or what we call positive changes to the child's skills, and it can be used to decrease any interfering behaviors or challenging behaviors, those behaviors that are interfering with the child learning.
Right.
So we're not talking about things like stopping them from stimming or things like that. We're talking about if they can't attend, they can't learn, and so they need to learn that skill.
Right.
The empirical support is good for ABA. There's
clearly
a lot of evidence. Again, we've talked about focused ABA already. Lots of times it's used for those things that are really important to parents.
Yeah.
So things like dressing, eating, sleeping, toileting, or really looking and focusing on those behaviors that are self-harming behaviors.
Right. Speech language pathology.
Speech pathology, again, has been around for a long time, has a body of research to support some of the things that we do as speech pathologists. It's a discipline that focuses on assessing and treating speech, language, communication delays or disorders, swallowing, voice disorders, and disfluency or stuttering. So it's got a broad scope of practice again. The three that I have slides on are the ones that are asked for the most in speech pathology services, and we'll go to this one first, is that overall, what is the evidence for speech therapy services? It's mixed.
Okay.
It's mixed
I
right
find
now.
that so odd, but we don't have time to get into that.
No,
but
we don't have time to get into that. Really depends on what you're looking at.
Okay.
Is it receptive language? Is it expressive language? Is it AAC? So again, we still require more research in the field of speech pathology to show effectiveness of some of the things that we're doing. If you're doing appropriate evidence-based practice, if we can go back to that diamond at the beginning, your own data, the speech pathologist's data from their treatment will tell you whether it's being effective or not. And so that's what guides you in this. Prompt therapy. So this is one of the things that is often requested from families of children with autism. And in prompt therapy, it's a specific type of articulation, like working on speech. And it's the outcome is to increase speech production, so better speech. But there's unestablished evidence for prompt with autism, and that's the important thing. There's established evidence for prompt with other disorders, but not with autism. There's only been one study to date from 2005, I believe, that had children with autism as part of the study. So even though people ask for this, it's not often recommended.
I need to apologize. I haven't done. We've had such a great conversation. I haven't done a great job in managing time, and I know that this is one of your sweet spots. It's all of them are. We want to get to making decisions, and we have a number of these items to get through: occupational therapy, OT services, this type of thing. Is there anything as it relates to occupational therapy that you want to ensure we touch on before getting to making decisions?
We can go the next slide. So this one is fairly new.
Okay.
Not fairly new in the field, but fairly new for emerging evidence of effectiveness.
Right.
So in occupational therapy, sensory diet, sensory integration has been something that occupational therapists provide, parents ask for, schools ask for. And what we've seen over the years is that the evidence hasn't been really great to support those things.
Okay.
But now what we're finding in the latest national standards report is that Jean Ayers, who actually develops the AIRS sensory integration, there are a few studies, 3 studies that look pretty good quality, that are saying that there are some good outcomes from it. So it's an emerging evidence for AIRS sensory integration. You have to be trained specifically in this technique. So that's something for parents to be aware of and to ask for. But overall sensory diets, like this slide shows, there's mixed evidence for just sensory diets overall. So, and I know they're used often in schools and things like that. And there is some question as to whether there's an outcome from them.
Okay.
SOS feeding is another one that's promoted a lot, both promoted from a business perspective and training, but also requested from parents. And it's a feeding approach, a feeding intervention. Many children with autism have difficulties with feeding, and they're really restrictive eaters, and it's a concern. It's a definite concern for parents. This particular feeding program, though, has unestablished evidence. So we need more studies directly looking at children with autism to see its effectiveness. It is not named in the National Standards Report because it doesn't have enough evidence at this time.
Well, I mean, one of the benefits of autism as a business, we talked about some of the negatives, one of it is all of this research that is coming out and these programs that are being developed by many right here in Ontario, which is great. Okay, so clearly we could talk all day long about each of these. This could be a full day class, not just an hour-long webinar, but regardless of how much you've retained of what went on, you've got your resources to download. Let's talk about what making the decisions. Okay, so we'll start with accessing more information.
Right, so one of the things that it's a really difficult task that parents face. You know, it's really difficult to have an individual with autism and to just get through your day and then have to make decisions like this where you don't have experience. It's very different than deciding what's my next car going to be. You know, we're all familiar with that, but you have no experience often in this. So what you're having to do is wade through all of this information, go out and try and find people, and then kind of interview them and see if there's a fit between your family, the needs of your child, and the provider. What we've done is there's a resource, so a provider checklist, that should help you with this decision, and it's comprised of a large number of questions to ask. And so that's really the recommendation. Ask questions, because your money is important, your time is important, your child's time is important. And so you don't want to kind of make the wrong decisions. And it's heartbreaking when you hear, I have calls from parents sometimes that is, you're the 10th speech pathologist. And it's heartbreaking because they've spent time, they've spent money, and they haven't found someone who actually has the training for that particular child. And so, you need to ask these questions. So download the resource, and I'm not going to read off all the questions, but it goes through things like ask about their credentials, right? Any provider is obligated through their professional credentialing to provide you with their credentials and training. Okay. So it's not an insult. It's like, oh, here you go. This is all my training. You need to understand contracts and fees because they're all different. Everybody operates a bit differently. Informed consent. You have to expressly written consent for assessment, for treatment plans. So you want to make sure you ask about those things. What's their scope of practice? Meaning, what areas do they have a lot of experience in? Training and experience. In speech pathologists, they may not have any training in AAC, which is augmentative and alternative communication. Or they may not have training in swallowing or feeding disorders. So you want to make sure that if that's your child's area that you want to increase, then you need to go find somebody else. Competency. How many individuals like your child have they actually seen? Right? I always say to parents, would you rather go to that surgeon who it's his first week on the job or someone who's had 5 or 10 years experience? It depends again on what you're doing, what your child is like, but you really want to ask them about their competency. Insurance. Are they insured? Do they have general liability insurance? Do they have professional insurance? Most will, because it's part of our registration. What do they do for assessment? Are you allowed to be in there? Can you watch it? Is goal setting something that they do with you? How often will the goals change? How often will you revisit the data from the goals, like to see what your child is doing? What kind of research base do they use? Do they keep up on the research? Are you allowed in? Open door policy, right? It's involvement, collaboration. Will they collaborate with other members of your team? Right. Because we know that interprofessional practice can give really good outcomes, but it takes collaboration. How much family involvement is there?
Right.
Do they ask you about your cultural preferences? Are they sensitive to your family dynamics or the stresses that your family is going through? Have they kept up in continuing education? And then supervision. How often, if they're using a occupational assistant or speech assistant or CDA or an ABA therapist, how often will they supervise those sessions? So you want to look at those things.
And then, once you have and you're in it, you know, as you mentioned, you've had people that have had multiple therapists before getting to you. How do they benchmark if it's working or not? That's got to be hard for parents coming in.
Very hard. I mean, what you're wanting to see from the very beginning are goals that are written in a way that they can be measured.
Right.
So what we talk SMART goals, right? That they're very clear, they're specific, they're measurable, they're appropriate, they're time limited. So it's not like, oh, in 2 years from now. It's like, no, in the next, 12 weeks or the next 3 weeks, we're going to see this. So you want to look at that data. You want to understand how that professional is making their judgment about whether it's working or not.
Right.
If it's not working, then you need to change things. I mean, we're here to help children. So you really want to look at that. And this is what evidence-based practice is in a different way, and the pathway. And so most professionals will look at following this pathway. So you have your baseline skills assessment, you determine what skills you need to work on. The professional should go to the literature base to see, okay, which intervention technique or program matches this best. Right. You determine your goals, you write them out, you present them with the family, you work together, you implement them, and then you're taking data so that the supervisor or the speech pathologist or the professional themselves can see, is this working? And that's the trick. Everybody is individual. And so what works for one person doesn't always work for another. And that's where social media often is really difficult to read from a professional, because parents will say, well, this worked for me. Oh, my child did really well with this. But we don't know if your child...
It's worse than that. It'll say, you should do this or you should do that.
You're right. It does say that.
Yeah.
Without knowing the evidence.
Right.
And without knowing that, does their child match your child?
Yeah.
They could be two completely different individuals. And it shouldn't work the same then.
Yeah.
Right? And so that's the thing, is to really look at all of that. And then your next steps. If it's not working, then you need to really rethink things, regroup, look at, just as almost the same as if you're going to a physician and you have a medical problem. If a certain medication that they give you doesn't work, you're not feeling better, you go back, you talk about it, you regroup, you try something else.
Right.
So you may need to, you may need to look for a different provider. Yeah. You may need to look for a different program. You may need to match it better with your child. And so this slide actually shows you how different things can be when you're taking into account all the information. And this slide is from Holland Bloor Review, and it's a YouTube video, and I gave the link in the resources. And it's a really nice presentation that goes through a lot of actually similar things that I've said today, but it actually can show you for your child 3 different ages, 3 different diagnoses. Child C also has ADHD as a comorbid diagnosis. Different skill areas that are in need, different considerations for the family environment, what's available to the family, what they're able to do, so different recommendations. Right? And that's the thing to keep in mind. It's going to be different from your friend or that person on Facebook.
Right, who says you should do this or that. What I love about what you've done here is that we've got a number of resources. You'll see them all here, and you'll be able to download them when you download the slides. But make sure that when you go to the resources that you hit all of them, because we've got these resources that are links to agencies, ministry, and professional bodies. Professional bodies is important. We talked about how an ABA practice should work or an SLP practice should work. Including links to all of the programs that we talked about. We have that provider checklist, which is very thorough, helping you when you're going out there the first time. And then in the additional resources, there is evidence for ASD treatments, reports, online reviews. If you saw something and you're wondering, is this right, and you want to become informed, you're able to go in and you're able to review that.
The other thing, I'm just going to interject a minute.
problem.
I know we're close to our time, but the other thing that I've done is provided a link for every one of these programs, these treatments and programs, so that you can go on their website. They also usually have a record or a listing or database of everyone who's been trained in those programs.
Right.
So you can, you can look at Timmins, Ontario, and see, okay, who's been trained in the Play project, who has ESDM, who has PRT. You can go to their website and see, oh, there's people in my area that have this. And so it's important to access that information.
Right, and I mean, for those who are starting their journey, you've consolidated everything they kind of need to get started, not to make it easy, but everything that you need. I'm going to give you a second before we leave just to give your moment of zen, if there's one thing you want to leave our audience with today before you go.
I think is that, reach out. Don't be afraid to ask questions of the provider. Don't be afraid to ask for more information. Really be a partner in it. This is a major decision.
Right.
We're used to doing a lot of due diligence for making big purchases like your house or your car. This is more important than that.
Right.
And so really, use some of the materials that we've given you and ask those questions.
And with that, we are out of time. I want to thank everybody for all the time that you gave us today. I know we didn't get to all your questions, but we have a commitment to get back to you in writing. Before you leave, the survey will pop up when I'm done my my little preamble here, but you can grab the survey on the left-hand side. Please fill that out. A reminder that this webinar will be recorded, archived, and available on demand by tomorrow at the Autism Ontario website. And this link actually is the link that it'll be available at. My apologies. So if you know anybody, any friends, family, loved ones, caregivers, anyone who you think would benefit from the content that we covered today, please share the link. The more people that come through this program, the more of these webinars we get to put on. So for myself, for Tracie, for Autism Ontario, thank you, and we look forward to seeing you at our next Autism Ontario event.